Community pharmacy funding for 2026-27 has been finalised. Following complex negotiations between the Department for Health and Social Care, NHS England, and Community Pharmacy England, a deal has been settled that will provide 10% more funding for community pharmacy. But although welcome, the uplift will not resolve the challenges facing the sector. Pharmacies are in deep financial crisis, following more than a decade of underfunding. And this year will see their workload and costs continuing to increase as prescription volumes and service expectations rise. So acceptance of the deal was conditional on a shared programme of reform to set future strategy. Pharmacies are at the heart of local communities. Across England, over 10,000 pharmacies dispense 1.2 billion prescription items annually, as well as offering walk-in advice and a range of clinical services. But they are operating under intense pressures, and a funding gap of over £2 billion has pushed the sector to the economic brink. We welcome the government's decision to once again prioritise funding to pharmacies with this settlement, and that they have taken positive steps to stabilise the increasingly volatile medicines supply system. We also support the principle of introducing independent prescribing into pharmacy NHS services. It will make use of skills that a growing number of pharmacists are gaining, allow more people to be treated safely and conveniently in their local pharmacy, and help relieve pressure on other frontline services. But the 10% funding increase will simply not be enough when taking into account activity and inflation growth. Over the next year, we expect pharmacies to do even more, dispensing 32 million more prescriptions and providing 3.2 million more clinical consultations. At the same time, they will need to absorb rising employment, business rate and energy costs. And setting up community pharmacist prescribing will require significant work, clinical governance and ongoing IT costs. The funding available, while welcome, will not make headway on closing the sector's funding gap. Instead, we will see continued instability, degradation of service, and risks to patient care and safety. At Community Pharmacy England, we see the challenges facing pharmacies, their patients, and the wider NHS as shared problems. And we want to work with the government to solve them. So whilst this deal is not perfect, we have accepted it, so that we can keep talking to ministers and keep working towards a sustainable future for pharmacies. We'll need your help in getting there, your support for our asks, your patience when pharmacies are struggling, and in calling for change in Parliament to support patients. Help us ensure a sustainable future for community pharmacy.